Now tell us about your hospital. We've heard you're the referral service. You're a full-scale continuing care kind of facility.
Yeah, I mean, we think of ourselves as a full treatment plan.
Right.
Okay?
All right. So who comes?
And it started with a hospital. We are the only dedicated facility in New England for eating disorders. So we have a general psychiatric unit, but we have a separate unit just for the treatment of eating disorders.
How many beds do you have in that unit?
We have 22 beds in that unit, and then we have an additional 16 beds of residential programming.
This is in the old Waltham Hospital?
The hospital.
Shouldn't say it quite that way, but
the hospital services are in that building, which is now owned by Children's Hospital, and we work with them around the space. And then we have these additional beds that are in apartments that are very close by, and they are a step down from the hospital. So the hospital is we really use the hospital for medical reasons, right? To get people medically stabilized so that they can begin to get their nutrition. Generally speaking, a lot of our patients are very low weight. And they really need to, we have to help them to start eating again. In other situations, they're binging and purging uncontrollably. We have to have them in a structured environment where these things are not possible for them to do, and begin to help them rework some of their behavioral patterns, even before we step them down to our residential program. But what we are really interested in is being able to provide not just those pieces, because what we found out is that we could do a pretty good job getting started, but that once we started to turn this around, the path to recovery takes quite a while and requires a lot of support. And you want most of this support to really happen and be provided to somebody who's living in the real world, because if you're doing it always in a structured environment, it's pretty the hardest part is when you go from the structured environment to the unstructured environment, to being on your own.
They can slip right back to where they were.
So we've now developed a number of programs for people who are living in the world and who come to treatment. Some come 5 days a week.
This is an outpatient program.
We think of them, we call them ambulatory, because it's not outpatient in the sense that one person would say, well, I come once a week. Because you're coming more intensively than that. You might come 5 days a week for a while. You might then come 3 evenings a week. For teenagers, we actually have the teens come with their parents 3 evenings a week, after school program. This is the part of the work that's probably the most difficult, and where most of the actual therapy gets done. Most of the work that allows for somebody to be on a path to recovery and actually make it through. And if you think about healthcare overall today, one of the biggest problems is integration of care, is really people knowing what they're doing and kind of following through. And in our experience, we've set up this group of programs so that we can follow through on the things that we've started, from inpatient to residential, partial hospital, intensive outpatient. And hopefully at that point they're ready to go back to their outpatient therapists and their primary care physicians for care. But likely they will continue to go for treatment for some period of time. And last week we heard the story of Suzanne Lewandowski, who has been a huge advocate for people with eating disorders, and who has been a great consultant to Walden, and convinced us that we needed to be in the Worcester area. She and Meta, and not that we really needed convincing. It's a lot of work to do, and it took us a while to get there. But
this is ambulatory patients.
This is you live at home, you sleep at home.
All right, but you have trained therapists who are working with people.
Yeah, each of our centers, our satellite centers, and we now have 3 and are building a 4th. Each of those centers has a group of psychologists and social workers. There's always a nutritionist on staff. There's always medical personnel, generally a psychiatrist or a nurse practitioner who specializes in these disorders. And they're supported from from Walden Central, if you will, with all kinds of training and backup and things like that.
The difficult question, the 800-pound gorilla in the room, is that there generally isn't too much in terms of financial support available for this kind of a program. And this is an expensive program because you're talking about long-term.
You know, 5 years ago, you would have been absolutely correct.
But things have changed?
Things have changed and are continuing to change, partly because there's been good advocacy on behalf of people with eating disorders. But almost all of our services are covered by insurance, by
Mass Health?
Mass Health covers some of our services. Not every insurance covers every service, but every insurance covers some of the services.
So what does the person do who is not independently wealthy in terms of getting help? You're not covered at all by insurance.
Mm-hmm.
What do they do?
So we work with each client individually. So if $80 is a hardship for someone to come in, we think about a sliding scale fee. We talk to them about who can you ask in your community. There is a lot of support through sometimes local departments of mental health. And then we also work with them on ways to talk to the insurance company. You know, keep notes, keep a journal, every conversation you have, do everything they ask you to do and document, you know, did that clinician they sent you to say they don't have openings, and fight for, you know, coverage outside your insurance when you're not getting far enough. You know, what we've realized too, there are a lot of lawyers in Massachusetts dedicated to making sure that people with mental health illness receive standard of care and quality care. So
And this is a mental health illness that we're talking about.
This is a biologically based mental health illness. So parity has made it much easier for people in the state of Massachusetts to get coverage for eating disorders. It's not saying it's perfect. It's by far not perfect, but
that was done initially when I was chair of healthcare in the Massachusetts legislature.
Mm-hmm. Well, thank
but
you.
It is, but it's not good enough.
It's not good enough, but it's a step, and I think teaching people with eating disorders that their voice matters and how to use that voice to get the care that they need and that they deserve is something that every facility in Massachusetts that treats eating disorders is trying to do.
What does it take to be a clinician for eating disorders? You have to be licensed as a therapist.
Well, you know, it's a very good question at a number of levels. Yes, you have to be licensed. You have to, but it's well beyond that. This is a subspecialty of a subspecialty, if you will, in many respects. It takes a good bit of additional training beyond being in school and beyond the usual type of internship that you go to. And there aren't very many places to get that training. We pretty much have to do that internally to train the people who work in our programs. And we do a lot of training at this point. And we prefer most of the clinicians, if at all possible, to really work in Waltham for a period of time before they then go to work in other sites. And for instance, in Worcester, our program director was the program director in Waltham for a period of time. And she's now out here as a program director. She's completely steeped in the way that we work and is doing lots of training herself now with her staff.
You know, it's hard to find therapists these days to begin with. That's one of our problems. There's always the fear, on my part at least, that some of the people who hang up their shingles as therapists, as psychologists, and especially if they do a subspecialty, as with a group as fragile as this group, that they could be charlatans. You have to be licensed, but you don't have to be certified in any way. Is this something that the state should be thinking about?
That's an interesting question. There are some movements nationally for certification within eating disorders, but we're very fortunate in Massachusetts. We have MEDA. And MEDA provides a professional link and is very knowledgeable about the people who are trained in this field. And maybe you want to talk a little.
Sure. So in order to be a professional member through MEDA, so that's for open to therapists, nutritionists, doctors, yoga specialists, you need a license first of all.
Right.
And then you also need to provide us with 2 letters of recommendation from people within the field who are already, leaders in the field. We also need a current resume. These people have to sign up yearly. They are given discounts to attend our national conference. We do networking events. We have groups so they can learn from others in the field that meet on a monthly basis. So we're sort of trying to make it so when someone calls, they're not going to get the runaround and go to a therapist who says, oh yes, I've treated clients before, and then say, oh, this is over my head. So we try to work with people and figure out which each therapist. A new therapist to the field might not be ready to see a client yet who has struggled for a certain number of years. So we work to get those therapists or nutritionists or doctors up to that level. But I do think, we need to think about it on a statewide level. We don't have enough providers right now who
Right.
are specializing in this.
We don't have
in
enough
this
providers,
area.
first of all,
Yes.
but specialists in this area are really few and far between. So how do they find Meta? I mean, my constituent was just desperate and didn't know where to go and who to call, and how do they, can you give us
Sure. I mean, the best way
contact information?
Sure. The best way to reach us is our website, which is www.medainc.org, medainc.org. Our telephone, we have an 800 number, 866-343-MEDA, or locally 617-558-1881. And, it's a staff that's always ready to pick up the phone and talk to anyone.
And you're located in Newton.
We're located in Newton, Massachusetts, yes.
And MEDA stands for Multi-Service Eating Disorders Association.
Yes, that's it.
MEDA, M-E-D-A. And if you can give us some contact information for Walden, we'd appreciate that as well.
So the local contact information, the phone number for Walden in Worcester is 508, I wrote it down, 796-5797.
And you're located in
And we
Worcester?
are located at 335 Chandler Street,
That's the old Tatnick bookseller, for
Old
those
Tatnick
of you
bookseller.
want a landmark there.
And a great way to get some information about Walden is to go on the website. It's a very large website with a lot of information. www.walden, as in the pond, Walden Pond, W-A-L-D-E-N, behavioralcare.com.
This is the beginning of a conversation, because I think this is a problem and a subject that we're going to hear more about and talk more about as it becomes more visible. We have to remove the stigma from it, first of all, so that people are comfortable talking about it. And that's why we've devoted 2 shows for this, because I think it merits that. I know that these folks would be interested in hearing from you if you think that they might be of help to you. I'd be interested in hearing from you as well. You can reach me at 617-722-1544 in Boston, or you can write to me on email at Harriet, Harriette .Chandler, CHANDLER, at masenate.gov. I'm interested in seeing how much interest there is out there in this issue, and whether we should go forward in terms of some sort of a coalition and some sort of a way of dealing with this on a much more statewide issue than it currently has. I thank you both, Dr. Komen, Kristen, for joining us and giving us a bit more information about, not a bit more, a lot more information about one of the secret problems of our society today in healthcare. I'm Harriet Chandler, your state senator in the 1st Worcester District. Thank you for joining us at Beacon Hill Chat. See you again next week, same time, same place.